name's Rachel King, and I'm a nursing student at the University of South Alabama, and I'm going to be demonstrating how to insert an NG tube. So first, I'm going to verify the order and hospital policy, and next I'm going to compare the patient's name and medical record number on their armband to the order form. So I have Jaguar Jones, medical record number 4176352, and I'm also checking for allergies. So I'm going to put on my goggles, position my trash can, and perform hand hygiene. Next, I'll raise the bed and lower the side rail, and I'll explain the procedure to the patient and ensure their privacy. I'll also check their vital signs. I'll auscultate for bowel sounds, and I'll check their oxygen saturation with my oximeter. If the patient has a decrease in O2 saturation or deterioration in vital signs, the NG tube insertion, or I'll stop the NG tube insertion. And the head of the bed should be in high Fowler's. I need to establish a Q sign with them if they need to stop. Okay, I already have my NG package opened, and I already have my 4 pieces of tape made, and I've already got my marker on here because I'm going to make another video later of me actually measuring it. So I have this so the tube can float, and then I have another piece of tape to temporarily secure it to the cheek, and I also have one more piece to put the time and date on there. So I would put some lubricant on here, and now I'm gonna put on my clean gloves. I would also need to loosen this plunger to make sure it's ready to go, and probably not stick my hand on it like I just did. So I'm going to assess the patient's nares to determine which side the NG tube should go in. So I would have them close one nares and breathe normally through it, and then do that on the other side. I would clean the nose with soap and water or an alcohol swab and pat it dry. So now I'll place the basin on the abdomen and the towel on the patient's chest. Okay, so now I'll lubricate up to 4 inches of the NG tube, and I would instruct the patient to tilt their head back, against the bed and swallow. So there's the water right there, and if they're NPO, they can just dry swallow. So now I'm going to insert the tube to the back of the throat going towards the ear, and I'm rotating at 180 degrees, and if I feel any type of resistance, I would stop the insertion. So now I'm going to place this in here. And attach my 60 milliliter syringe. Okay, so if the patient had started to cough, or there was a drop in their O2 stats or they appear to be in any type of respiratory distress, I would have withdrawn the tube into the posterior nasopharynx until they appeared to be breathing normally again. So now I'm going to temporarily secure this to the side of the cheek. And there should probably be a little bit more slack in that, but I don't want to pull it out all the way. So I would also need to check the placement in the throat. So I would use my pen light and my tongue blade to make sure that it's in the right place. And also for correct placement, I would check by aspirating gastric contents and assessing the pH if it was indicated. And I would also help with x-rays if they were ordered. So I would now take a skin, or I would now secure the skin to the nose with or the tube to the nose with a skin prep and clip the NG tube to the gown, making sure there's slack, and that also varies according to hospital policy. I would also get a marker and make a mark right here to act as a guide for placement so I could see if it had moved or anything. And I would adjust to a low wall intermittent suction if it was ordered. The head of the bed should be no lower than 30 degrees. The side rails should be lowered. The bed should be lowered and the side rails should be up. And I would assess the patient for comfort. And I would then clean up my workspace. I would throw this away, but I'm not going to, well, I'll throw it away. Okay. It accidentally fell on the floor and missed the trash can. Love that. So clean up my area. So I would recap this, or if there was suction, I would hook it back up to the suctioning like this. But for now, I'm just gonna cap it, and this should be above the stomach at all times. This blue little tube should be above the stomach at all times. So it would be up here somewhere, but it's gonna be right here for now. So I've got this moved. I got that. Okay. So now I would document the type of NG tube that I placed. I would document the size, the time I did it, the location, which nares it was, and verify the location, how the location was determined, and if suction was used. I would also note the patient's tolerance, the color, amount, and characteristics of the secretions. And if it was ordered, I would properly discontinue the NG tube. So I would have taken these off before I documented, but I'm just sitting here verbalizing everything, so I'm not really trying to remember. So I would have taken those off before I documented, but anyway, so if it was ordered to for the NG tube to be discontinued, I would perform hand hygiene, raise the bed again, lower the side rail, explain the procedure to the patient. I'm gonna lay a towel back over their chest. Gonna put on my clean gloves. That I never want to go on. So once I get these on, I would auscultate the abdomen for bowel sounds. Oh my gosh. Oh. Okay. Let's see. Alright, there we go. So I would auscultate for bowel sounds. I would turn off the suction and remove the tape. So tape is removed, suction's off if it was previously on. That's not going to come off. And I would gently and slowly remove the tube. Place it on the towel. Ooh. Just like that. And finally, oh, I would have, so I should have kinked it whenever I took it out instead of just pulling it out. Yeah, so I should have kinked it, but I didn't. Finally, I would remove my gloves before I went to the computer and documented, but this time I would document the drainage and perform oral hygiene.